I would like to pass the floor to Saurabh Dalal, leader of Emergency Preparedness and Risk Management, WHO India. He's a person with very important experience and also representing a situation that is clearly connected with your history. Maybe some of the people that you are mentioning are living in India, some of them, I mean, the individuals that we mentioned. I think that is something that maybe Saurabh is going to talk about now. Over to you, dear Saurabh.
Thank you, Walter. Thank you, Ashish and Ashwina, also for giving me this opportunity. And this subject is close to everyone's heart. So even at odd times of the hour, all of us are present here with a smile on our faces. So I'll share my screen and take you through a small journey. I'll be speaking about, So I look after emergency preparedness and risk management at WHO India, but I have been involved with the WHO headquarters in developing a system for early warnings and the common alert protocols for rolling, which is being now rolled out in as a joint collaboration between WHO and WMO in certain piloted countries. As well as I have been, of course, because India has been discussed a lot, but this subject has been so close to my heart because this exactly started when I was holding a position at the National Disaster Management Authority and was responsible for developing the first ever guideline on the National Heat Wave Action Plan. So I have been a part of the journey since 2015, the revisions in 17 and 19, and have seen a lot of progress happening in this area. But also at the same time, I am the biggest critic because if we stop inventing this wheel, then I think the progress made will not be, the progress made will not sustain for a very long period of time. The first and the very foremost question is heat wave a disaster? It took us around 11 years to realize that heat wave is a disaster. From this year onwards, it is considered as a national disaster. So, the policy reforms take 11 years to even understand from a national perspective that heat wave even is a disaster. And I think the messages that we are trying to pass on to the communities, the messaging that we are trying to pass on to the states, the government, and the implementation factors, somehow the understanding of us as actors who are promoting the policies, because it's a developing science, was not very clear, and it is now getting clearer day by day. So, for example, the first question is heat wave a disaster? Now, the answer, if says yes, then let us take it to a global level. Is heat wave a disaster not just in India or in other countries as well? How is it defined? On what parameters? Everyone is, because it's somewhere stuck between the concerns of climate change and disaster risk reduction. And somehow we tend to deliver a lot of mixed solutions without addressing the basics. So, while I was working in the capacity of in charge of medical preparedness and developing the guidelines on heat wave, my first reaction was, is heat killing people, or do we need to convince the community to understand the phenomenon of wet bulb globe temperature? So that particular question raised a lot of issues. Then if a death or, from the first presenter, Mr. Kamal Kishore, to Kathy, everyone highlighted about mortality and morbidity data. But do we really have a system of capturing that kind of data? So, while we were developing the systems to work on those kind of very tough questions rather to answer, and also, if there is a death happens anywhere in the country or maybe globally, is there a doctor who is empowered to write on a prescription, that can potentially sue the government that it's a heat wave related illness or a heat wave related death? If we are not empowering our physicians, 90% of the death certificates which are written in the world, even at this point of time, does not mention heat as a cause of death. So how do we account the number of deaths that are happening because of heat wave? So, and why are we, working about a lot of solutions? Because there are a lot of mitigation measures. So Smith K, a very renowned public health author, has given a very good statement that the rich will find their world to be more expensive, inconvenient, uncomfortable, disrupted, and colorless. In general, more unpleasant and unpredictable. But the poor will die. And this is exactly what we have been seeing in terms of heat wave. So we talk about early warning actions, we talk about a lot of usage of AI, but ground level implementation is always, as policymakers, should remain and very close to our heart, and that is how action are being designed. So my question and my quest of working in the area of heat wave began that why in the area of heat wave management it is affecting us is because human health is one of the largest casualties of heat wave. And now since we have started experiencing it because of various factors, because of various problems that are arising because of heat wave, rising temperatures, and also heat related vulnerability, urban heat islands, and other phenomena, we are taking action because it is affecting us in a larger way on day-to-day basis to vulnerable populations and everyone else. So we in this entire process we also learned a lot of things. There is a lot of investment that is happening in this place since around like 2 decades now, but is the investment happening in the right place? So I'll give you a very good example. We in the year 2015 we made very good educative films for a heat wave, and the National Disaster Management Authority of India made a law to showcase it in multiplexes and cinema halls, where the people who can afford a cinema ticket are not going to be a target or victims of heat wave. So it was a useless investment. Soon enough, the government realized and changed it to a different low cost forms of risk communication, which could go down to the community that were going to be affected the most, and really benefit from that kind of risk communication. And we are not done yet. The bigger elephant is already in the room, and that is El Nino. We are already, at the verge of starting to experience the effects of El Nino. Effects are already happening. And as WHO, we have already started doing a risk assessment on what important indicators that we should be focusing on, what are the patterns that are going to change, and which regions of the world are going to get affected. Most likely, parts of Australia, parts of Southeast Asia, and East Africa will be the worst affected as it changes the pattern. The concern with us, apart from the shifting rainfall pattern, the crop patterns, and other areas, is more extreme higher temperatures. This year, probably in Southeast Asia, the heat wave season that we see normally from 2015, which were averaging around 10 days per year, is already extended up to around 45 red alert days in this 2020-26. But this year, because of El Nino, we are likely to see a prolonged expansion of heat wave red and orange days for around 60 days in this particular financial year. The situation is not just good for Southeast Asia, bad for Southeast Asia, but also equivalently dangerous for Europe as well. So many of the European nations are, planning to combat the vulnerabilities because of heat extremes, but again, the basic lack of certain systems. And we have seen these systems. There were deaths that were there in Tokyo. There were deaths that were there in France. But still, we do not have confirmed number of deaths from these locations because these are aggregate deaths. And at the end of the day, and at the end of the financial year, when annual death data is being accounted for, at most of the times, even in the European countries, and in because of not having a definition of a heat wave as proper, it is being attributed to many other causes of deaths. So, particularly for India and for Southeast Asia, the season from June to August is going to be extremely abnormal. And how it is going to affect the health So we are already seeing a lot of abnormal vector-borne outbreaks that are happening in India. We are seeing a rise in heat-related illnesses, of course, but at the same time, this year the heat-related illness reporting has gone into 3 digits, which were not the case in past 2 to 3 years. And there is also a severe rise in acute respiratory infections. And there are a lot of like as a country like India, when we as per the Inform Index, the readiness as well as vulnerability uh, doesn't coincide in a very positive area of this graph. So that's why country needs to take higher measures and very substantive actions in terms of reducing the mortality and morbidity. And that is what we probably tried and achieved something by the rolling out the National Heatwave Action Plan. So from 2015, where there were 240 cases reported, by 2020 we were able to bring down the number of deaths in single digits. And the result of that was that every year the national plan was being upgraded. Following Ahmedabad, Nagpur, many other cities that were there in India, which followed the trail of creating their particular heatwave action plans. We were, as administrators and policymakers, we were clear which states were going to get affected. So if someone from Bihar, Rajasthan, or Delhi would come and say that there have been heatwave related death, the policymaker would clearly say till those years that the death cannot happen in those areas because of heat waves. And that much clarity persisted at that point of time, and it was state specific disaster. Around 17 different departments and agencies at city level took coordinated efforts. They had plan of actions, they had different roles and responsibilities divided at organizational and departmental level. Those things are now, I think the successes of the past should not be reiterated again and again. And we have achieved what we have achieved, but for me as a person who is working in this area, there is immense amount of work that needs to be done. The situation, however, has not changed. For example, people still rely on low-cost innovations and uh, 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 in India, what we say as jugaad technology to deal with a lot of heat-related impacts, but it has not been very scientific enough in dealing with the outcomes of heat vulnerability. So the cool roofing, or maybe bringing awareness among people regarding the different categories of heat wave. For the success of intervention uh, lies if your last mile uh, is aware of what kind of impact it is going to create on that. So, for example, in states like Gujarat and Rajasthan, or maybe in Maharashtra, most of people are aware what is a red alert, what is an orange alert, and that is a successful conversion of a policy from a national level to a household level. And people are also applying methodologies like cool roof technology or limited working hours and reducing their exposure to extreme heat periods. But having said that, it is not done. We reduce mortality and morbidity. It is a success story. It's a multi-sectoral effort, and it has been well appreciated by all the global agencies as well. But I see a lot of challenges as well. Health sector is not ready, in not just in India, and I'm talking it about the load that increases on critical wards, ICUs, dialysis, neonatal units during, especially in heat wave period. The cooling that affects the normal homes, the hospitals are not ready to deal with that kind of surge in number of patients. We have seen this year around 7 isolated events, not just in India, but also in Bangladesh and Nepal as well, where the hospitals were not able to cater to the rising heat wave related casualties. And but there are innovations. So some of the good practices that we propose and promote as WHO is to rather than catering to the population coming to the hospital, uh, establishing heat stroke clinics in the hospitals and also within the community, has been successful pilots in around 2 to 3 states in India, but it is a cost-effective intervention. But due to lack of human resources and also intensive resource constraints, these things are not working very well. What exactly needs to be done now is we know what health department needs to do. We want data as a whole, but we want to now fragmentalize on what every individual within the healthcare system needs to do. For example, as a district health officer, as a district surveillance officer, as a head of a medical emergency department or medical superintendent of a hospital, at a CHC or a PHC, or even during mass gathering events like Ramadan or maybe festivals or marathons where we lose the maximum number of people. So that is where the intervention needs to start. And I'm talking only about healthcare sector. People are not clear about their individual roles. So a very prominent practice that exists in every country is passing on the early warning system signals to everyone. Rather, like, every we cannot expect a nurse working in a hospital to be an expert understanding a meteorological department advisory. So we need to convert that early warning into early action into a translatable message, what really she needs to do. For example, a medical superintendent needs to create a surge in his or her hospital, while a nurse and a doctor responsible in an emergency department can also create a surge capacity within the emergency department itself. That the health officer or a district surveillance officer can ensure that the reporting of the cases, whether it is the heat related illness, heat related exhaustion, heat stroke or heat stress, or heat related deaths, that happens on very regular basis at around 60% of locations in Southeast Asia. It is happening only on weekly or monthly basis. And at the end of the year, when we segregate and collect the data is around 40% fraudulent even now. So creates a big challenge, and it is not a solution that can be solved with AI, because the manual data entry and it is related with the patient care and has to be entered naturally. There are some innovations that are also giving us a little bit of relief. For example, there are some ambulances which are specifically thermal safety units and are being deployed in several states in India. And they have a they are paired with the cooling shelters, and they have shown some good side of relief in certain heat prone states. If we don't do it, people have a lot of innovation within themselves and they will innovate. But we need to be ahead of the curve. For example, this practice of resilient warehouses is being extensively adopted by pharmaceutical sectors in Gujarat as well as in Tamil Nadu, where they have, especially in medical units, they have focused on uh, a lot of vaccines, a lot of drugs that get denatured or uh, non-usable because of heat related effects and thermal properties of them. So they are taking extra care in the warehouses, and the entire operational supply chain is becoming more and more logistically resilient for that purposes. Similarly, uh, the sick building syndrome and building related illnesses and the guidelines or the policies that the government for low cost solutions that are being implemented across the world are being implemented, but at the same time, are we doing enough to make them approachable, make them cost effective to every citizen? uh, Heat is also becoming a major issue in transportation sector. For example, this year, Delhi government has specifically rolled out a heat action plan for transportation sector, and that's a way one of its kind, because a lot of people who are traveling in non-air conditioned buses and working especially in airport terminals, and where they are exposed to prolonged working hours, and in transportation where they do not get air conditioning support are vulnerable to heat stress. One of the rising issues and now being acknowledged everywhere is mental health and neurophysical impacts of heat wave. People are getting a lot of neurological symptoms. Their sleep cycles, hormonal regulation is being affected. That can be solved, and for the first time in the helpline of mental health, even heat wave is being considered as one of the uh, things that has to be responded to for mental health response. At the same time, in this place, in this particular issue, AI can play a very big role. I'll give you an example of Bolivia, where now the focus is shifting from delivering a generalized healthcare solution to targeted healthcare solution that also impacts healthcare. And one of the solutions that my team members have implemented was Calma. Calma stands for Cal or maternidad, for example, and this is a specific solution that was designed conversion of early warning system, and it was an AI-based system where maternal mortality and registry was linked with the early warning systems and through a chatbot, and all the women and neonatal registry was linked with a chatbot which gave them regular uh, referral mechanism, awareness regarding the heat waves and why they are in risk group, what they can do, and if they are experiencing certain discomfort, how they can counter that. At the same time, this AI chatbot was also being monitored by the health system at the back end through a dashboard. So this pilot was done in around 6 districts in Bolivia, and now is being scaled up into 7 other countries as well. At the same time, the heat wave national alert
Laura, please,
system. Yeah, I'm
excuse me.
just about to finish. Yeah.
Yeah, please, if you can try to summarize, because we know how big is your experience and also the country that you
Yeah.
represent and the entity, but we need to try to give
Yeah,
space to
sure.
the next presenter, please. Thank you.
Yeah. So the takeaway message from my presentation is cadre specific actions that we need to do, who needs to do what, how, and when. Enable quicker implementation of interventions, because a lot of interventions die even during the policy phase. And I'm very happy when Ashwin showcased the heat wave tabletop exercises. That kind of scenario, Gen AI based scenarios, simulators are required, and more heat wave related exercise. I think for the first time, Harvard University has started doing heat wave simulation exercises. Not we? Why can't we do it at all the levels from the national, district, and state level? Better accountability, responsibilities, and the last question: we, not as just policymakers, what have we done? Not just qualitative or quantitative bit, what we have contributed to the science, but at the same time, while we are building our homes, are we thinking on all those aspects that we are talking about, or are we implementing all the same strategies and solution? Am I sitting right now without an air conditioner? The answer is yes, and I can say it. So that kind of solution and knowing your own roles in dealing with this kind of long term challenge is what I would like to convey from this. And thank you for having me. It has been a long day, but at the end of the day, it's very pleasant to see all the smiling faces. Thank you.